When you're heading off on that trip, it's worth thinking through what's going to be out there which is going to cause trouble to you, and then looking at how you can stop that affecting you. So part of that's the obvious piece around making sure you've got the right vaccinations. Sometimes that can even stop you getting into country if you don't have the yellow fever vaccination, for example. So you need to do the planning, what's required. That involves both some research online, but also talking to your GP for advice. And talking to other travellers as well can help just to get an idea of what those exposures could be. So vaccinations, then having the right medications to treat things that you could pick up, whether that's some diarrhea and some vomiting, or whether that's some just general stuff that you get in the UK could still happen to you when you travel. So having the right meds and making sure those meds are from reputable organisations. Sometimes buying overseas, you can't guarantee that the medications aren't counterfeit. So a focus here is on planning, then going out purchasing and building that med kit. And alongside that is making sure you've got the right meds that you can travel with. So some countries don't allow you to travel with codeine and other types of medications. So think about making sure that the whole of your transit route enables you to take those medications with you. One piece that really stands out for me is malaria. We need to make sure that the malaria advice you've got is up to date and correct. There's a lot of myths and rumour around malaria. It kills people, it's significant, and you need to make sure you've got the right medications for where you're going. There is resistance to chloroquine in some of the malaria medications, so it's worth just researching it, finding out from someone who's competent at this what you should be taking. And then when you're in country, be fastidious about avoiding being bitten, and then when you get back, make sure if you do feel unwell, and that would be having a temperature for maybe 24 hours after being in a malaria area, you need to get a check out and make sure you haven't got malaria. And if you slow treatment there can have a really bad outcome, and we do have 12 to 14 deaths a year in the UK with people who've contracted malaria coming back and not getting treatment. So just to summarise there, you've got to do your research, find out what you're going to be exposed to, get your vaccine sorted, and then make sure you've got the right medications to keep yourselves healthy.